Welcome students to the lecture 3 of the unit. This unit will focus on the tools for collecting spiritual histories that belong to the formal approach. Formal approach include questionnaires with open-ended questions. The nursing literature now offers a wide variety of questionnaires which have been developed in recent years in different social and national contexts. These questionnaires partly reflect local cultural specificities which affect, for example, the linguistic formulation of the questions or the way, more secular or more religious, the concept of spirituality is treated. In the use of these instruments, there's therefore the problem of their cultural validation, namely, the assessment of their appropriateness when used in social and national contexts other than those in which they are originally constructed. These tools are useful in particular in the phase of the patient's admission to the hospital in order to carry out the spiritual screening that serves for an initial collection of information. Among the many questionnaires which are part of the formal approach, we'll consider some examples of qualitative questionnaires with open-ended questions, which have the characteristic of being short and named with acronyms, two requirements which make them quickly administered and easily memorable by nurses in the course of their everyday activities on the ward. One of the most discussed and tested instruments in nursing is the FICA questionnaire, which is used to collect spiritual histories in a clinical context. This questionnaire focuses on 4 spiritual dimensions: faith, the belief system or spiritual orientation with which the patient identifies; importance or influence, the relevance of spirituality in the patient biography and the influence it may have in the care pathway; community, the membership of a particular religious or spiritual group and the possible support the patient may find in that group; address or action in care, the use of spirituality in the care pathway. For each of these 4 dimensions, there's a set of questions that seem them detailed for each dimension. To investigate the dimension of faith, the questionnaire includes questions such as: do you consider yourself to be spiritual, or is spirituality something important to you? Do you have spiritual beliefs, practices, or values that help you to cope with stress, difficult times, or what you are going through right now? What gives your life meaning? In the case of the second dimension, importance or influence, the questions are: what importance does spirituality have in your life? Has your spirituality influenced how you take care of yourself, particularly regarding your health? Does your spirituality affect your healthcare decision making? The questions of the third dimension, community, are the following: are you part of a spiritual community? Is your community of support to you, and how? Is there a group of people you really love or who are important to you? Finally, for the last dimension, action in care. How would you like me, as your healthcare provider, to address spiritual issues in your healthcare? This tool can be administered during the first visit to the patient or during periodic examinations that the patient undergoes. A second questionnaire is HOPE, whose function is to explore the spiritual resources of the patients. Again, spirituality is divided into 4 areas: Hope, the sources that give hope, meaning, love, sense of peace and connection with reality. Organized religion, membership of a religious group, church, spiritual community of reference. Personal spirituality and practice, concerning spiritual beliefs and practices pertaining to the individual sphere of the patient, regardless of adherence to an organized religion. Effects on medical care, the management of the patient's spirituality, beliefs, practice, feeling, such as fear or loss of trust, during the course of the care process. As in the FICA questionnaires, the 4 dimensions are investigated with a series of questions. Let's look at the typical questions of these questionnaires for each dimension. For the first dimension, hope, we have been discussing your support system. I was wondering, what is there in your life that gives your internal support? What are your sources of hope, comfort, and peace? What do you hold on to during difficult times? What sustains you and keeps you going? For the organized religion dimension, do you consider yourself part of an organized religion? How important is this to you? What aspects of your religion are helpful and not so helpful to you? Are you part of a religious or spiritual community? Does it help you? How? The dimension of personal spirituality in practice includes questions like these. Do you have personal spiritual beliefs that are independent of organized religion? What are they? Do you believe in God? What kind of relationship do you have with God? What aspect of your spirituality or spiritual practices do you find most helpful to you personally? Finally, about the fourth dimension, effects. Has being sick affected your ability to do the things that usually help you spiritually? As a doctor, is there anything that I can do to help you access the resources that usually help you? Are you worried about any conflict between your belief and your medical situation or care decisions? Would it be helpful for you to speak to a clinical chaplain in a community or spiritual leader? Are there any specific practices or restrictions I should know about in providing your medical care? The questionnaire can be used as a follow-up for diagnostic discussion or planning of palliative care interventions. On this slide, you will find some bibliographical references for further reading on Lecture 3. Thank you for your attention.